Today, many veterans are not taking advantage of the benefits that they're entitled to. So today I want to talk about veterans and Medicare. My name is Dave Sambor, founder of My Health Architect, and it's a company that I created for the sole purpose of helping clear the confusion. So today, that confusion is about Medicare and how it affects veterans. There's two things I want to cover today. One is going to be why veterans should enroll in Medicare Parts A and B, and how veterans can get Medicare for little or no cost. So let's take a step back to begin with. If you're already a veteran, you already know how the system works as far as VA benefits. But for those who don't, here's a quick review. For retired military, which means they've served for 20 years, they're entitled to something called TRICARE for life. Then there's also another plan that's called CHAMP VA, which is for the spouses of disabled veterans. And the third area is really for veterans that have served for 24 months or whatever contract term they did sign up for. They're entitled to VA benefits. For the purpose of this, I'm just going to focus on those that just are in that VA benefits category, not the TRICARE for life or the CHAMP VA. So once someone who's a veteran who has VA benefits turns 65, they also have that Medicare option. So what this does is they can still go to and get all the benefits of the VA, all the VA benefits. This does not conflict, does not detract, it doesn't go as a replacement for, but veterans can have both Medicare and the VA. And they can be used basically used interchangeably. So one thing many don't realize is actually the Department of Veteran Affairs does recommend that veterans do sign up for Medicare Part A and B. But the reality is actually 10 to 15% of veterans who could sign up for that don't. Again, and there are some things we're going to talk about in a second here, which would really hopefully get those other 10 to 15% that really should be signing up for that benefit. But a lot of this goes to why would someone sign up? So the one really good thing about the VA benefits is they do have very good prescription drug programs. It's something that again, it's a very, very good setup for them there. But that doesn't mean you can't also have a alternative with prescription drug benefits, through a Medicare type setup. So let's just step back and say, well, why sign up? Why should we sign up? Why should someone who's a veteran sign up for Medicare? So one of the biggest reasons is timing. So when you sign up, when you turn 65, if you do not sign up for Medicare Part B at that time, you decide later, you know what, I really like to take advantage of some of these opportunities, some of this coverage. There is a lifetime penalty involved with that. So that Part B, when you sign up for Medicare, as of 2024, was $174.40. So what that would mean is, let's just say you would turn 68 in 2024. You didn't have Part B yet. Instead of being $174.40, because of a 3-year delay in signing up, you're going to have a 30% penalty, which means you're going to pay an additional $52 and some odd cents, 52.41 per month to be able to have that Part B. Now, again, I'm going to talk about in a second. If you fall in that category, there's some ways to partly mitigate those additional costs for you, and we'll cover those in a minute here. But why would someone want Medicare Part B if they have good VA benefits? Well, one of the biggest reasons is a second opinion. So if you're going to the VA and there's a certain diagnosis, prognosis that they have for you, and I really would like to get a second opinion. If you have Medicare, then you have other avenues that open up where you can go see to get that second opinion. Another option at time becomes timing. Sometimes you just want to be able to get in quicker for something. Or let's say maybe you actually would rather work with someone more locally, closer to you than the VA, as far as maybe for therapies and those types of things. Having Medicare alongside of a VA benefits could potentially open up more of those opportunities for you. So, what are some other reasons for that? So, with Medicare overall, the veterans that do have Medicare kind of fall in one of three categories. One is they could just have original Medicare, which means they sign up for that Part A and Part B, they pay that Part B premium, and they have access to a level of care and a network of doctors they could see for that. Others will kind of fall into the category of the Medigap. Medigap just means that they have original Medicare and they actually pay a premium to kind of cover some additional expenses beyond what base Medicare covers. But the third part of that is a Medicare Advantage plan. So the veterans that do have Medicare, About 40 to 55% only have the original Medicare. You have another 15 to 20% that has that Medigap, and then you have roughly 30 to 40% that are on some sort of Medicare Advantage plan. So again, for those that are on just original Medicare, that means they're paying a Part B premium per month, and they may or may not be using those services along the way in conjunction with their VA benefits. So for them in particular, there's some very interesting options at virtually little to no cost that they really should be taking advantage of, and maybe right now are not. So you mentioned, what about those Medicare Advantage plans? So those are called kind of the Part C of Medicare. And a lot of times those Part Cs are going to have some extra benefits. So some of those may include things like dental, vision, hearing. They could have a food card. They could have some fitness benefits. All additional things that they could get as being a part of that Medicare Advantage plan. But see, and some of these may or may not include a prescription drugs plan. But probably the biggest thing people don't realize is many of these plans that are designed for veterans have what's called a give back. So in other words, let's just say you're on original Medicare, you're paying your Plan B premium as the Department of Veteran Affairs recommends to sign up for that. So you're paying that. It's maybe coming out of your Social Security check every month. And maybe you're not really utilizing a lot of the benefits from Medicare. So with the Medicare Advantage plan that actually is a give back plan, what that'll do is it could reimburse you for a large portion, up to 100% of that Part B premium. So in essence, let's say you're turning 65, you're a veteran, you love your VA benefits. The best thing to do is actually sign up for Part B and then enroll in a Medicare Advantage plan that could be a give back that again gives you all these extra benefits along with it, and you'll avoid any penalties down the road if you ever decide you want to take part more in what those Advantage plans have to offer. Now, what this also do? So now you have more flexibility with your benefits. Potentially you flex food cards, the fitness, the dental, those types of things. You have different networks you'd be involved in. There could be an HMO, which has a tighter network, could be a PPO, a little bit larger network of doctors you could see, just giving you more flexibility along the way. The great thing too is you're not locked into this forever because every year these plans adjust. And so that's where the big advantage is sitting down with someone who's been doing this, someone who can guide you through that whole process. So in hindsight, overall, I guess not hindsight, but maybe in the bigger picture in summary, you can add these other plans for little or no cost. It's going to let you take advantage of having more flexibility. The best thing to do is really find an independent agent who understands how the VA benefits work, how Medicare can work with the VA benefits, and someone who represents a wide range of companies just to be able to give you options along the way. The best thing too, hey, if you decide to work with me, there is no fee associated with that. Any compensation is done directly from the insurance companies, only if we actually find something that is of benefit for you. So with that, hey, I'm happy to help you or veterans take advantage of some of these benefits that are out there available to them and that they're entitled to, and they may just not understand that they have that options for them.